The coagulation cascade is a series of steps the body uses to form a blood clot and stop bleeding, also known as hemostasis. It's divided into three pathways: the intrinsic, extrinsic, and common pathways. The extrinsic pathway is one of the two main pathways of the coagulation cascade, the series of steps that leads to the formation of a blood clot. This pathway is initiated by external trauma that causes damage to a blood vessel. It's a rapid response that is crucial for stopping bleeding from an injury. Steps of the extrinsic pathway. 1. Tissue factor exposure. When a blood vessel is damaged, a protein called tissue factor, factor 3, is released from the injured tissue into the bloodstream. Tissue factor is a crucial trigger for this pathway. 2. Factor 7 activation. Tissue factor binds with circulating factor 7, a clotting factor that is always present in the blood in its inactive form. This binding forms a complex, which then activates factor 7, turning it into factor VIIA. 3. Activation of factor X. The newly formed complex of tissue factor and factor VIIA then activates factor X into its active form. The intrinsic pathway is one of the two main pathways of the coagulation cascade, a series of enzymatic reactions that leads to the formation of a blood clot. This pathway is activated when blood comes into contact with a negatively charged surface, such as the collagen in a damaged blood vessel wall. Unlike the extrinsic pathway, it doesn't require an external tissue factor to initiate the process. The coagulation cascade. The intrinsic and extrinsic pathways both lead to the activation of factor X, which is the starting point of the common pathway. This common pathway then culminates in the conversion of fibrinogen to fibrin, forming a stable clot. Fun mnemonic. To remember the sequence of the intrinsic pathway, you can use the following fun mnemonic. If you're going to a party, you need to remember the names of your friends so you can have fun. Here's how it breaks down. Party. Factor 12, Hegman factor, is activated by a negatively charged surface, like a party room with a lot of static electricity. It's the starter of the party. Names. Factor XI, plasma thromboplastin antecedent, is activated by factor 2E. This is like remembering the names of your friends at the party. Friends. Factor X Christmas factor is activated by factor XA. You need your friends to have a good time. Fun. Factor 8, antihemophilic factor A, is a cofactor that helps factor IXA activate factor X, bringing the fun. The common pathway is the final stage of blood clotting. It starts when factor X is activated. This triggers a cascade that converts prothrombin into thrombin. Thrombin then turns fibrinogen into fibrin, which forms the initial soft clot. Finally, factor 13 strengthens and stabilizes this fibrin clot, making it a firm seal to stop bleeding. The coagulation cascade is a three-part process that creates a blood clot. Intrinsic pathway. This pathway is activated by internal damage, such as when blood comes into contact with the negatively charged surface of a damaged blood vessel. It's a longer, more complex pathway involving several clotting factors, including factors 12, 11, IX, and 8. It culminates in the activation of factor X. Extrinsic pathway. This pathway is initiated by external trauma that causes blood to leak from a vessel and come into contact with tissue factor, factor 3, a protein found outside the blood. This pathway is much faster and simpler than the intrinsic pathway, involving only factor 7 and tissue factor before it also activates factor X. Common pathway. This is the final shared pathway where both the intrinsic and extrinsic pathways converge.